Diabetes. It's a word we hear often, a disease impacting millions globally. Diabetes is a metabolic disorder that affects how our bodies use glucose, a type of sugar that serves as our primary energy source. In a healthy body, insulin, a hormone produced by the pancreas, acts like a key, unlocking cells to allow glucose to enter and be used for energy. However, in diabetes, this process is disrupted. Sometimes the pancreas doesn't produce enough insulin, or the body's cells become resistant to it, leading to a buildup of glucose in the bloodstream. This silent epidemic, often symptomless in its early stages, can lead to devastating complications if left unchecked. Understanding diabetes, its various forms, and potential complications is crucial not just for those living with it, but for everyone. To grasp diabetes, we need to delve into the balance of sugar and energy in our bodies. When we consume food, our digestive system breaks down carbohydrates into glucose, releasing it into our bloodstream. This rise in blood glucose triggers the pancreas to release insulin. Think of insulin as a key that unlocks the doors of our cells, allowing glucose to enter and fuel our bodies. In type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Without insulin, our cells starve, and glucose levels in the blood rise dangerously high. In type 2 diabetes, the body becomes resistant to the effects of insulin, or the pancreas doesn't produce enough to meet the body's demands. While both type 1 and type 2 diabetes involve dysregulation of blood sugar, they are distinct conditions with different underlying causes and treatments. Furthermore, diabetes encompasses a spectrum of disorders, each with unique characteristics and challenges. One such condition is diabetic ketoacidosis, or DKA, a life-threatening complication primarily associated with type 1 diabetes. DKA occurs when the body, starved of glucose due to a lack of insulin, starts breaking down fat for fuel. This process produces ketones, acidic byproducts that accumulate in the blood, disrupting the body's delicate pH balance. Another serious condition, hyperosmolar hyperglycemic nonketotic syndrome, or HHNS, is more common in type 2 diabetes. HHNS is characterized by extremely high blood sugar levels, leading to severe dehydration and electrolyte imbalances. Understanding these nuances is crucial for prompt diagnosis and effective management. Diabetes insipidus, a rare condition, is not related to insulin or blood sugar regulation, but stems from problems with a hormone called vasopressin, which regulates water balance in the body. Diabetic ketoacidosis, or DKA, often appears as a frightening specter in the lives of individuals with type 1 diabetes. It represents a severe metabolic imbalance, a crisis triggered by the body's desperate attempt to survive when starved of its primary energy source, glucose. In this state of metabolic emergency, the body turns to fat stores for energy. The breakdown of fat produces ketones, acidic byproducts that rapidly accumulate in the bloodstream. This buildup of ketones disrupts the body's delicate pH balance, pushing it into a dangerously acidic state. Understanding the mechanisms behind DKA is crucial for both patients and their families. Early recognition of DKA symptoms is paramount, as prompt intervention can often mean the difference between life and death. DKA doesn't appear out of the blue. It typically develops gradually, often over 24 hours, with subtle warning signs that can escalate rapidly if ignored. One of the earliest and most noticeable symptoms is excessive thirst, a desperate plea from the body trying to dilute the high sugar concentration in the blood. This insatiable thirst often goes hand in hand with frequent urination, as the kidneys work overtime to flush out excess glucose. As the body's internal environment becomes increasingly acidic, a telltale fruity odor might be detected on the breath. Alongside this unusual breath odor, nausea and vomiting often set in, further exacerbating dehydration and electrolyte imbalances. Perhaps the most alarming symptom of DKA is the onset of rapid, deep breathing, known as Kussmaul breathing. This labored breathing is often accompanied by abdominal pain, adding to the patient's distress. DKA is a serious condition requiring immediate medical attention. The cornerstone of DKA treatment lies in prompt hospitalization, where healthcare professionals can closely monitor the patient's vital signs and provide life-saving interventions. Intravenous fluids become the first line of defense, replenishing lost fluids and electrolytes, restoring hydration, and stabilizing blood pressure. Alongside fluid resuscitation, insulin therapy takes center stage. Intravenous insulin administration allows for precise dosage adjustments, effectively lowering blood sugar levels and halting the production of ketones. This two-pronged approach addresses both the hyperglycemia and the acidosis, gradually guiding the body back towards a state of metabolic balance. Early recognition of DKA symptoms and prompt medical intervention significantly improve outcomes, reducing the risk of long-term complications. While DKA primarily affects individuals with type 1 diabetes, hyperosmolar hyperglycemic nonketotic syndrome, or HHNS, typically presents in those with type 2 diabetes. Unlike DKA, HHNS is characterized by extremely high blood sugar levels without the presence of ketones. This distinction arises from the fact that individuals with HHNs often have some residual insulin production, preventing the breakdown of fat for fuel and subsequent ketone formation. However, this absence of ketones doesn't make HHNs any less dangerous. The extremely high blood sugar levels in HHNs lead to severe dehydration, often far more pronounced than in DKA. This extreme dehydration disrupts the delicate balance of electrolytes, essential minerals that regulate vital bodily functions. HHNS typically develops gradually, often triggered by underlying illnesses or infections that stress the body's already compromised ability to regulate blood sugar. Infections, particularly urinary tract infections, pneumonia, and sepsis, are common culprits in triggering HHNS. These infections release inflammatory substances that further impair insulin sensitivity, exacerbating the underlying hyperglycemia. Additionally, certain medications, such as corticosteroids, can contribute to HHNs by interfering with insulin action. Dehydration itself can become a vicious cycle in HHNs. As blood sugar levels soar, the kidneys try to eliminate excess glucose through urine, leading to increased fluid loss and further dehydration. This dehydration, in turn, worsens insulin resistance, creating a dangerous spiral that requires prompt medical intervention to break. Understanding these triggers is crucial for effective management. HHNS often creeps in silently, its symptoms subtle at first, easily mistaken for other ailments. This slow onset, coupled with the fact that many individuals with type 2 diabetes may not meticulously monitor their blood sugar, can lead to delayed diagnosis and increased risk of complications. Early recognition of HHNS is paramount, as prompt medical attention can significantly improve outcomes. One of the earliest signs of HHNS is increased thirst, a desperate plea from the body struggling to cope with skyrocketing blood sugar levels. This insatiable thirst, however, often goes unnoticed, particularly in older adults who may not experience thirst as acutely as younger individuals. As dehydration worsens, confusion sets in, a telltale sign that the brain, starved of fluids, is struggling to function optimally. This confusion can manifest as disorientation, difficulty concentrating, and even hallucinations. As HHNS progresses, seizures may occur, a terrifying consequence of electrolyte imbalances and severe dehydration. Treating HHNs is like navigating a labyrinth, requiring a multifaceted approach to address the underlying hyperglycemia, dehydration, and electrolyte imbalances. Hospitalization is almost always necessary, providing a controlled environment where healthcare professionals can closely monitor the patient's condition and deliver life-saving interventions. Intravenous fluids become the cornerstone of HHNS treatment, replenishing lost fluids and electrolytes, restoring hydration, and stabilizing blood pressure. Alongside fluid resuscitation, insulin therapy plays a crucial role in lowering blood sugar levels. However, unlike DKA, where rapid insulin administration is often necessary, HHNS typically requires a more gradual approach to avoid potential complications. Identifying and treating any underlying triggers such as infections is equally important in managing HHNs. Antibiotics, if an infection is present, become part of the treatment regimen, addressing the root cause of the metabolic disturbance. Continuous monitoring of vital signs, blood sugar levels, and electrolytes remains crucial, allowing healthcare providers to fine-tune treatment strategies and prevent potential complications. While diabetes mellitus, in its various forms, dominates the landscape of metabolic disorders, another condition, often mistaken for its more prevalent counterpart, lurks in the shadows: diabetes insipidus. This rare disorder, though sharing a name that evokes sugar imbalances, has nothing to do with insulin or glucose regulation. Instead, it stems from a disruption in the delicate balance of water regulation, a symphony orchestrated by a hormone called vasopressin. Vasopressin, produced in the brain's pituitary gland, acts as the body's water conservationist, signaling the kidneys to reabsorb water from urine, preventing excessive fluid loss. In diabetes insipidus, this hormonal messenger system falters, either due to a lack of vasopressin production or the kidney's inability to respond to its signals. Understanding this fundamental difference, that diabetes insipidus is not about sugar but about water, is crucial for both diagnosis and treatment. Recognizing these distinctions is paramount in providing appropriate care and preventing potential complications. Imagine a leaky faucet, relentlessly dripping water, unable to be fully shut off. This constant loss, if not replenished, can quickly deplete even the largest reservoir. Such is the plight of individuals with diabetes insipidus, their bodies caught in a relentless cycle of water loss and insatiable thirst. The hallmark of this condition, dehydration, casts a long shadow, affecting various bodily functions. Excessive urination, often exceeding 3 liters per day, becomes a constant burden, disrupting sleep, work, and social life. This relentless fluid loss leads to a perpetual state of thirst, a desperate plea from the body struggling to maintain hydration. As dehydration worsens, fatigue sets in, a consequence of the body's struggle to function optimally in a water-deprived state. In severe cases, untreated dehydration can lead to seizures, coma, and even death, underscoring the importance of early diagnosis and appropriate management. Diagnosing diabetes insipidus is like piecing together a puzzle, requiring a combination of clinical evaluation, laboratory tests, and sometimes imaging studies. The journey often begins with a thorough medical history and physical examination, where the doctor will inquire about the patient's symptoms, focusing on their pattern of thirst and urination. A simple yet telling test, the water deprivation test, often plays a pivotal role in confirming the diagnosis. This test involves withholding fluids for a specific period, carefully monitoring the patient's weight, urine output, and urine concentration. In individuals with diabetes insipidus, the kidneys, unable to conserve water effectively, continue to produce large volumes of dilute urine despite the fluid restriction. Blood tests to measure electrolyte levels and serum osmolality, a measure of the concentration of particles in the blood, provide further clues. Imaging studies, such as magnetic resonance imaging, MRI, of the brain, may be necessary to rule out any structural abnormalities affecting the pituitary gland or hypothalamus, regions of the brain involved in vasopressin production and regulation. While diabetes insipidus, with its relentless thirst and frequent urination, might seem like an insurmountable challenge, effective treatment strategies exist to alleviate symptoms and improve quality of life. The cornerstone of treatment often lies in replenishing lost fluids, ensuring adequate hydration, and addressing the underlying hormonal imbalance. For individuals with central diabetes insipidus, where the root cause lies in insufficient vasopressin production, synthetic vasopressin, available as a nasal spray, injection, or oral tablets, becomes the mainstay of treatment. This synthetic hormone effectively replaces the missing vasopressin, signaling the kidneys to conserve water and reduce urine output. The dosage and frequency of administration are carefully titrated based on the individual's response and tolerance. In cases of nephrogenic diabetes insipidus, where the kidneys fail to respond adequately to vasopressin, treatment focuses on addressing the underlying kidney problem and managing symptoms. Dietary modifications, such as reducing salt intake, can also play a role in managing symptoms, as salt tends to worsen water loss. Section 1. Navigating life with diabetes. Insipidus, practical tips and strategies. Living with diabetes. Insipidus requires adapting to the constant need for hydration and managing the challenges of frequent urination. Imagine carrying a water bottle as a constant companion, ensuring access to fluids throughout the day, whether at work, school, or social gatherings. This simple yet crucial habit becomes second nature, a small price to pay for maintaining well-being. Planning ahead for bathroom breaks, especially during travel or outings, helps alleviate anxiety and prevent embarrassing situations. Communicating openly with family, friends, and colleagues about the condition fosters understanding and support, creating a more accommodating environment. Wearing a medical alert bracelet or necklace, clearly stating diabetes insipidus, can be life-saving in emergencies, alerting first responders to the need for immediate hydration. Maintaining a regular sleep schedule and managing stress through relaxation techniques, such as deep breathing or meditation, can positively impact hormone balance and overall well-being. Remember, knowledge is power, and understanding the intricacies of diabetes insipidus empowers individuals to take charge of their health, leading fulfilling lives despite the challenges. Section 2. Diabetes, a shared journey of support and understanding. Living with diabetes, whether mellitus or insipidus, is not a solitary journey. It's a shared experience, a tapestry woven with threads of support, understanding, and empathy. Family and friends play a pivotal role in this journey, providing emotional support, practical assistance, and a listening ear during challenging times. Open communication about the condition, its symptoms, and treatment strategies fosters understanding and helps break down barriers of fear or misconception. Educating loved ones about the importance of blood sugar monitoring, medication adherence, and healthy lifestyle choices empowers them to become active participants in the journey. Support groups, both online and in person, offer a safe and welcoming space for individuals with diabetes to connect, share experiences, and learn from one another. These groups provide a platform for exchanging practical tips, coping mechanisms, and emotional support, fostering a sense of community and shared understanding. The power of knowledge empowering individuals with diabetes. Knowledge is power, especially when it comes to managing a chronic condition like diabetes. Empowering individuals with the right information, tools, and resources is crucial for effective self-management and improved health outcomes. Diabetes education programs, often offered through hospitals, clinics, or community centers, provide comprehensive information about the condition, its complications, and treatment options. These programs cover a wide range of topics, from understanding blood sugar fluctuations and medication management to healthy eating habits, exercise recommendations, and strategies for preventing long-term complications. Learning how to interpret blood sugar readings, administer insulin injections, or adjust medication dosages empowers individuals to take an active role in their health. Furthermore, understanding the impact of lifestyle choices, such as diet and exercise, on blood sugar control, equips individuals with the knowledge to make informed decisions that positively impact their well-being. Remember, knowledge is not just about understanding the science behind diabetes. It's about translating that knowledge into actionable steps that empower individuals to live healthier, more fulfilling lives. Embracing a balanced lifestyle, nutrition, exercise, and blood sugar control. Managing diabetes goes beyond medication and medical appointments. It's about embracing a balanced lifestyle that supports overall health and well-being. Nutrition plays a pivotal role in this equation, as food choices directly impact blood sugar levels. Imagine your plate as a canvas, each food group representing a different color, contributing to a vibrant and balanced masterpiece. Opting for whole grains, fruits, vegetables, lean proteins, and healthy fats provides essential nutrients while minimizing blood sugar spikes. Portion control is key, as even healthy foods, when consumed in excess, can lead to blood sugar fluctuations. Regular physical activity, like a refreshing breeze, invigorates the body, improves insulin sensitivity, and helps regulate blood sugar levels. Whether it's brisk walking, jogging, cycling, swimming, or dancing, finding enjoyable activities that fit into daily routines makes exercise sustainable and rewarding. Remember, small, consistent changes in nutrition and exercise habits can have a profound impact on blood sugar control and overall health, paving the way for a more energetic and vibrant life. Regular monitoring, the cornerstone of diabetes management. Imagine a ship navigating treacherous waters, its captain relying on a compass and maps to chart a safe course. Similarly, regular monitoring serves as the compass and map for individuals with diabetes, providing crucial information to guide treatment decisions and prevent complications. Blood sugar monitoring, the cornerstone of diabetes management, unveils the ebb and flow of glucose levels throughout the day, revealing the impact of food, exercise, medication, and stress. This self-monitoring empowers individuals to make informed decisions about their diet, activity levels, and medication dosages, keeping blood sugar within a healthy range. Regular checkups with healthcare providers, like scheduled maintenance for the ship, ensure everything is functioning optimally. These visits provide an opportunity to review blood sugar logs, discuss any concerns or challenges, and make necessary adjustments to the treatment plan. Additionally, regular screenings for diabetes-related complications, such as eye exams, kidney function tests, and foot checks, help detect any potential issues early on when interventions are most effective. Section 6. Staying ahead of the curve, preventing long-term complications. Diabetes, like a persistent wave, can gradually erode the shores of health if left unchecked. However, by staying ahead of the curve, implementing preventive measures, and actively managing the condition, individuals with diabetes can significantly reduce the risk of long-term complications. Imagine a sturdy seawall, built to withstand the relentless force of the ocean. Similarly, maintaining healthy blood sugar levels through medication, diet, and exercise acts as a protective barrier, reducing the likelihood of damage to blood vessels and nerves. Regular blood pressure and cholesterol checks are crucial, as these factors, when elevated, can further increase the risk of heart disease, stroke, and other cardiovascular complications. Quitting smoking, a habit that damages blood vessels and exacerbates diabetes-related complications, is paramount for preserving overall health. Foot care becomes paramount, as diabetes can impair circulation and sensation in the feet, increasing the risk of infections and ulcers. Regular foot inspections, wearing comfortable and supportive shoes, and seeking prompt medical attention for any cuts, blisters, or sores are essential for preventing serious foot problems. Section 1. The Eye's Habit, Safeguarding Vision in Diabetes. Our eyes deserve special attention in diabetes management. High blood sugar can damage eye blood vessels, leading to diabetic retinopathy. Early detection and treatment reduce vision loss risk. Regular eye exams and managing blood sugar are key. Vision is precious. Stay vigilant, attend regular eye exams, and manage blood sugar to keep vision clear. Section 2. Kidney Care, Preserving Function in Diabetes. Our kidneys filter waste from our blood but are vulnerable to diabetes. High blood sugar can damage kidney blood vessels, impairing filtration. Early detection and intervention can slow kidney disease progression. Regular urine tests and blood pressure control are essential. Medications and a healthy lifestyle can protect kidney function. Section 3. Nurturing nerve health, preventing neuropathy in diabetes. Our nerves, intricate messengers, are vulnerable to diabetes. Imagine delicate wires, their insulation wearing down. High blood sugar damages nerves, especially in hands and feet. Symptoms include tingling, numbness, pain, and muscle weakness. Maintain healthy blood sugar with medication, diet, and exercise. Early detection can reverse or slow nerve damage. Regular foot exams are essential to prevent serious infections. Section 4. Mental well-being. Navigating the emotional seas of diabetes. Living with diabetes affects both physical and mental well-being. Imagine navigating a vast ocean, reflecting the emotional ups and downs of life with diabetes. Daily management can lead to stress and burnout. These feelings are normal and common. Seeking support from loved ones or a therapist helps. Support groups offer community and understanding. Activities like hobbies and mindfulness reduce stress. Taking care of mental health is crucial. Section 5. Charting a course for the future. Research, innovation, and hope. Ongoing research and technological advancements hold immense promise for diabetes treatment and a cure. Imagine a ship on a journey, its sails billowing with the winds of innovation. Scientists tirelessly explore new avenues for prevention, detection, and treatment. Clinical trials test novel medications and stem cell therapies. Technology revolutionizes diabetes management with continuous glucose monitors and insulin pumps. The global diabetes community stands united in the fight against this condition. Advocacy, education, and fundraising efforts support a brighter future for those affected by diabetes. Imagine a world where managing diabetes no longer requires constant vigilance. This vision is becoming a reality with the artificial pancreas. This system acts as an automated blood sugar regulator, mimicking a healthy pancreas. It includes a continuous glucose monitor, an insulin pump, and a control algorithm. The monitor measures blood sugar, the algorithm calculates insulin needs, and the pump delivers insulin. This closed-loop system improves blood sugar control and reduces complications. Preventing diabetes remains a top priority despite advancements in treatment. Imagine a world where diabetes incidence decreases through healthy choices. This vision is achievable through individual action, public health initiatives, and research. Lifestyle modifications are crucial in preventing type 2 diabetes. A balanced diet and regular physical activity improve insulin sensitivity and prevent weight gain. Public health initiatives can profoundly impact population health, turning the tide against diabetes. Section 3. Diabetes in the spotlight. Raising awareness, fostering understanding. Diabetes, despite its global prevalence, often remains shrouded in misconceptions and stigma. Imagine a spotlight shining brightly, illuminating the realities of this complex condition, fostering empathy, and encouraging open dialogue. Raising awareness is crucial for early diagnosis, effective management, and ultimately, finding a cure. Public awareness campaigns, educational programs, and media coverage play a vital role in dispelling myths, promoting accurate information about diabetes prevention and management, and encouraging individuals to seek timely medical attention if they experience any symptoms. Schools, workplaces, and community centers can host educational events, workshops, and screenings, empowering individuals to take charge of their health and support those living with diabetes. Sharing personal stories, whether through online platforms, support groups, or public speaking engagements, helps humanize diabetes, breaking down stigma, and fostering a sense of community among those affected by this condition. Remember, knowledge is power, and by shining a light on diabetes, we can create a more informed, supportive, and proactive society, united in the fight against this global health challenge. Section 4. You are not alone. Embracing hope and resilience in the face of diabetes. Receiving a diabetes diagnosis can be overwhelming, evoking fear and uncertainty. Imagine a vast ocean, its waves representing diabetes challenges. Remember, you are not alone. Millions navigate the same waters facing similar challenges. Connect with the global community for support and shared experiences. Diabetes does not define you. Embrace hope with advancements in research and technology. Focus on healthy choices and celebrate small victories. Living with diabetes is a journey. Discover inner strength and resilience. Embrace support, celebrate resilience, and never give up hope. Section 1. A Journey of Knowledge and Empowerment. We've journeyed together through the intricate landscapes of diabetes, exploring its various forms, understanding its challenges, and uncovering the tools and strategies that empower individuals to live full and healthy lives. From the silent epidemic of diabetes mellitus to the acute crises of DKA and HHNS, we've shed light on the complexities of blood sugar regulation and the importance of early detection and proactive management. We've learned that knowledge is power, that understanding the intricacies of this condition, from the role of insulin to the impact of lifestyle choices, is paramount for effective self-care. We've explored the importance of regular monitoring, medication adherence, and healthy habits, nutrition, exercise, stress management, as pillars of a balanced and fulfilling life with diabetes. And we've delved into the importance of community, recognizing that no one should face this journey alone. The support of family, friends, healthcare professionals, and fellow individuals with diabetes provides a network of strength, shared experiences, and unwavering encouragement. Section 2. Embracing a future of hope and innovation. The future of diabetes care shines bright with hope and innovation. Researchers are driven by a vision of a world free from diabetes. Technology offers a future where managing diabetes is automated and less intrusive. Clinical trials explore novel medications and potential cures. Prevention remains our most potent weapon. Promoting healthy lifestyles and raising awareness can stem the tide. Behind the statistics are real people on unique journeys. Let's approach diabetes with compassion and support. Diabetes presents challenges, but it does not define us. By fostering hope and working together, we can create a brighter tomorrow.